Hi everyone, and welcome to our webinar tonight, where we'll be covering the application and selection process for the Australian General Practice Training Program with the RACGP. My name is Chloe and I'm from Membership Operations at the college. Tonight's webinar is Victorian focused, and we have MCCC and EVGP training providers here with us tonight. We also have an EV registrar, Dr. Damien Hannon, and an MCCC AGPT program manager, it's Lynn Marie Richards with us, who will give short presentations and will also be available for questions at the end of the webinar. We're very glad to have you with us tonight. So if you've tuned in today, it's likely you're considering general practice as the medical specialty in which to build your career, or seeking to obtain fellowship with the RACGP if you already work in general practice. We hope that tonight's webinar will provide you with some useful information. So let's get started. If you are having any technical difficulties, please use the question box in the pane and let us know if you can or can't hear us properly. Before we begin, I'd like to do an acknowledgement of country. The Royal Australian College of General Practitioners acknowledges Aboriginal and Torres Strait Islander peoples as the traditional custodians of the land and sea in which we live and work. We recognise their continuing connection to land, sea and culture, and pay our respects to elders past, present and future. So taking a look at tonight's agenda for the webinar, we'll do an overview of the program with the RACGP. Then we'll delve into the different training pathways, general, rural and rural generalist. We'll then have a look at the different training experiences that you'll have while you're on the program in hospital, general practice, and then undergoing extended skills terms. We'll then have a look at the RACGP selection process, which covers 3 main stages. And then we'll briefly cover some of the changes made to the selection process for the first intake as a result of the impact of the coronavirus. We'll then have a presentation from EV Registrar Dr. Damien Hannon and MCCC Registrar Education and Support Coordinator Lynn Marie Richards. We'll then take a look at some quick FAQs and some helpful resources and some key contacts that you will need for the program. And then we'll get straight into question time, where you'll be able to ask some region-specific questions for MCCC and EV for those of you considering training in these areas. Please keep your questions rather general about the selection process. For queries about personal circumstances, please contact RACGP Education at racgp.org.au, and we will provide that email address again at the end of the webinar. So just taking a look at the GoToWebinar control panel, you are on mute, so we can't hear you. You won't have access to all of the functions listed here, which is okay, you won't need any of them. But again, if you have any issues, please do let us know during using the question pane. The goal of undertaking training is obtaining fellowship with the college, and any fellowship allows GPs to work unsupervised anywhere in Australia. The program itself is 3 years in duration, which includes a first year in hospital, which is 12 months working and learning in a hospital setting, including rotations relevant to general practice. Those GP terms then make up a 2nd and 3rd years of the program. And then there's an option to complete an additional 4th year of training and work towards a fellowship in advanced rural general practice, which entails advanced rural skills training. There are no ongoing training or education expenses apart from the RACGP membership and cost of undertaking your fellowship exams. So training towards the FRACGP undertaken along either a general or a rural pathway. The curriculum is the same for both, however, the context in which you train influences the way these skills will be utilised. So let's take a look at the general pathway. The general pathway is suitable for doctors who wish to train primarily in the inner and or outer metropolitan areas. There are specific requirements for each of the training pathways in terms of where you can complete your GP terms, and these are all outlined in the Department of Health's AGPT program training obligations policy, which we encourage you to take a look at. You can find this by following the AGPT resources link at agpt.com.au. The training locations are defined as city, rural, remote, or very remote according to the modified Monash model or the MMM. And it's really important to be aware of how your preferred training locations are classified. This information can be found on the Department of Health's website using the Health Workforce Locator. Another important thing to be aware of is if you're subject to the Section 19AB of the Health Insurance Act 1973, you may not have the option of training on the general pathway and may be restricted to training on the rural pathway only. Please, we encourage you to research whether this applies to you. And further information about the Section 19AB is available on the Department of Health's website at health.gov.au. Okay, let's take a look at the rural pathway. This pathway is most suitable for doctors interested in training towards fellowship of the RACGP in rural or remote parts of Australia. It enables you to develop additional skills and gain greater depth and breadth of experience, build strong community connections, and access clinical opportunities in the context of hospital and community-based work. Again, it's important to be aware of the training obligations associated with this pathway, how your preferred training regions are classified, and to find out whether you're subject to Section 19AB of the Health Insurance Act. RACGP applicants also have the option of working towards fellowship in advanced rural general practice, as I mentioned earlier, or what we also refer to as the RACGP, which is undertaken alongside training of the RACGP. The RACGP entails an additional 12 months of training in which you gain advanced rural practice skills. As part of working towards a RACGP and a RACGP, you may also choose to participate in the Rural Generalist Training or RG training, which is a new option introduced by the Department of Health in 2018. This option provides an opportunity to develop a broader scope of practice that will enable you to meet the unique demands of working in smaller communities, including gaining advanced skills in areas such as obstetrics, gynecology, anaesthetics, and emergency medicine, to name a few. The AGPT Rural Generalist Program also offers additional flexibility, including an additional 52 weeks training time, an additional 52 weeks available allow for leave and extensions of training time, and flexibility around training region transfers if required, because we acknowledge that you may not be able to have access to the unique skills in one certain area. If you do intend to undertake rural generalist training, you need to indicate this on your AGPT application form, which is available through SAMS and online portal. Moving on to the training experiences you will have on the program. The first year of training takes place in a hospital setting and you are responsible for obtaining that position. There are mandatory rotations that need to be completed before commencing GP terms. These are general medicine, general surgery, emergency medicine, and pediatrics, among others that provide a variety of experience. Mandatory rotations do not need to be completed before applying for the program, but must be completed before commencing your first general practice term. Pediatrics experience can be difficult to obtain as part of a dedicated rotation, so other options are available. We do recommend you speak to MCCC and EV if you're looking at applying for training in Victoria, as they can provide information on the full range of options to gain these rotations. The paediatric term requirement guidance document is also available on the RACGP website, which does provide further information into that paediatric term requirement. If you have the required experience working in a hospital, you may be eligible for recognition of prior learning or RPL. This can reduce hospital training time with a maximum reduction of 52 weeks available. If you are accepted onto the program, MCCC and EV will assist you with your application and submit it to RACGP on your behalf. The RACGP censor will then review your application and decide on your RPL outcome, and then you will be notified. There is no guarantee that RPL will be approved. However, you can provide a CV to your preferred RTO and gain some preliminary advice. When you commence GP terms, you do so in a supported environment. This is when general practice education really begins. You will work with your RTO to find a suitable practice for each of the terms, and you will complete 18 months total in general practice terms, comprised of 3 terms of 6 months in duration. The final 6 months can be used to develop extended skills or to complete a further GP term. There is the option of training on a part-time basis, but you will need to discuss this option with your RTO and have any special arrangements approved by them. If you do take up this option, you need to ensure that you comply with the RACGP's part-time requirements, 14.5-hour minimum working week, including a minimum of 10.5 hours spent patient-facing. Requirements for part-time training is outlined in greater detail in the RACGP's vocational training pathway requirements for fellowship policy, which is available on the RACGP website. Finally, you will be paid for your time in practice. Visit the General Practice Registrars Australia website or GPRA and visit the national terms and conditions for the employment of registrars for further details. The GP earnings calculator on there is a very useful tool for estimating your potential earnings as a GP registrar. During your time on the program, you have the opportunity to undertake extended skills training. This consists of a 6-month post that will extend the depth and the breadth of your skill base in a specific area relevant to primary medical care. There are many different options available, including dermatology, palliative care, sports medicine, pediatrics, obstetrics, and many more. That brings us to the end of our overview of the AGPT program. Hopefully you have an idea of what is more broadly involved. We do encourage you to do your own research in order to educate yourself further about the expectations and obligations associated with the program. We'll now move on to an overview of the RACGP's eligibility and selection process, which is broken down into 3 main stages: application and eligibility, the national assessment, and then interviews and offers. The first stage of selection, as I said, is application and eligibility, in which you put forward your application and are assessed to determine whether you are eligible to participate in the AGPT program. Applications for the first intake of the 2021 AGPT program opened on the 23rd of March and has been extended to the 11th of May at 10 a.m. Australian Eastern Standard Time. This gives you approximately 7 weeks in total to complete and submit your application. We recently extended the time frame to allow for any disruptions that you may be experiencing due to the current situation with COVID. Please make sure you have finalised your application by the deadline. It's very important to do so. In order to begin your application, please visit the RACGP website. There are links available there that will take you to the relevant page or the SAMS portal, which I referred to earlier, to either begin or continue your application. Applicants will be notified about whether they are eligible to participate in the program by the 2nd of June 2020. However, you may be notified sooner. This is just the final eligibility date. You start the process by registering via the RACGP website. The link provided will take you to a page where you complete a form, entering your personal details. After this, you'll receive confirmation of registration via email, including information on how to access the AGPT portal and begin your application. The application form itself has a number of sections asking you to provide personal details, your previous work history, and qualifications. You'll also be asked to upload relevant supporting documentation. Eligibility guidelines are available on the RACGP website and provide further information on the eligibility process. As part of your application, you will enter your training region and pathway preferences. Choosing preferences is not a decision to be taken lightly. Please do think very carefully about where you want to train before completing this section of the application, and only nominate training regions you have a serious intention of training in. In making this decision, it is important to consider the number of training places available in each region for each pathway. Information on this is available on the RACGP website. The number of training positions for each region and pathway is limited, with some regions being more competitive than others. You are unable to amend your application once submitted, with the exception of updating your contact details, prior hospital experience, and uploading further documentation. This option only becomes available to you if the RACGP has requested further documentation. Once you submit your application, it will be reviewed by the RACGP's AGPT eligibility team to determine whether you are eligible to participate in the program. When you do apply, your application is categorised. These categories determine what information you need to supply as part of your application related to mandatory supporting documentation. Your classification is determined in the first part of your AGPT application using very straightforward questions as shown on the flowchart here. This is also available in the AGPT 2021 eligibility guidelines that I mentioned earlier, which are available on our website. There are no limitations on the number of applicants per classification who are made eligible for the program. These are simply used to determine what information and documentation you will need to provide when making your application. All applicants are required to submit the following documentation, no matter the classification. Further mandatory documentation, as discussed, this is determined by your classification. Please refer to the eligibility guidelines towards the back of the guide for more detailed information on this. These need to be original documents that have been scanned or photographed in colour. If you are not able to have the original document scanned or photographed in colour, you will need to have the scanned document verified. Certification needs to have taken place within the last 18 months. Your application is only considered complete if it is submitted before 10 a.m. on the 11th of May 2020 with all mandatory documents attached. Incomplete applications will not progress. As discussed, it is important, an important part of your application is nominating your preferred training region and pathway combinations. It is crucial to think carefully about which training regions you nominate in your application, because you are effectively stating that you are willing and able to train in one of these areas for the entire duration of the AGPT program. This means that you need to research the areas you are interested in thoroughly to gain a clear idea of whether they are locations you can feasibly live and work in. We do recommend speaking to EV or MCCC if you do go ahead and apply in Victoria, as they provide as I said, they provide the training in Victoria and they have the valuable regional knowledge that can help you in making these decisions. It's also important to talk to your family about your preferences, as the decision will impact them also. When completing this part of your application, you need to enter at least one training preference and can nominate as many as 4, which is highly recommended. These preferences must all be unique, meaning that you cannot enter the same training region and pathway preference more than once. The application form won't allow this to happen. There will also be an opportunity following the release of the CACT results, or the Candidate Assessment and Applied Knowledge Test, to re-evaluate your training preferences, and we will touch on this again shortly. Here we have a map detailing the 2 training regions in Victoria. When considering your training preferences, we do encourage you to learn where the boundaries lie to ensure you are preferencing correctly. If you are in doubt about which locations lie within each of the regions, please contact the relevant RTO, either MCCC or EV. They will be able to provide you with this information. Here is a more up-close version of the MCCC training region. And this is an up-close version of EV's training region. These maps are both found on the respective RTO websites if you would like to have a further investigation. Okay, moving on to stage 2, which is the national assessment, or the Candidate Assessment and Applied Knowledge Test. All eligible candidates are invited to enrol. For this intake, the CACT is expected to take place across 3 days, from Thursday 25th of June to Saturday the 27th of June. The RACGP is exploring different options for conducting the assessment that meet current requirements for social distancing. This may lead to changes, including potentially an extension of the exam period. If you have commenced or completed an application, the college will notify you of any changes that occur, and updates will continue to be posted on the website. Unfortunately, there are no alternative dates available at this stage. If you are unable to take the test on these dates, unfortunately, you cannot participate in this intake. The CACT is a computer-based exam. It takes 2.5 hours and is made up of 70 questions. 50 of these are situational judgment test questions, as we call SJTs, and 20 of them are knowledge test questions, which we refer to as KTs. The cost for the exam is $725, and please note you can only sit this exam once per year. Once you have been deemed eligible for the program, you will be contacted by the RACGP via email and invited to enrol for the CACT. The invitation email will provide instructions on how to log into the RACGP website and enrol. If you're not already an RACGP member, you will need to set up a password, and there will be instructions provided on how to do this. The next step is reading through and accepting relevant policies before paying the selection fee. If the final step is enrolling in the CACT via the CACT provider's portal. The exam provider is Pearson VUE. Here you select your preferred date, time and location. If the CACT is conducted in a new format because of the social distancing requirements we're still under, these steps may change slightly depending on the options available to you. As I mentioned earlier, if changes do occur, we will make sure that you are kept up to date with the latest information. Within the test itself, there are 50 situational judgment test questions, or SJTs. These may take one of two forms. Either the question will ask you to choose the most appropriate actions from a list of options, usually 3 actions from 8 options, or the question will ask you to rank answers from the most to the least appropriate. SJT questions are based on reason, logic, and ethics, so it's not possible to study for them. They seek to test how you would react in a particular scenario. They are not testing your knowledge, but rather your professional judgment. There are also 20 knowledge test questions, or KTs, and these aim to test your clinical knowledge. KTs do not cover a broad range of medical knowledge, but focus on acute emergency situations and potentially serious conditions. KTs are pitched at pre-vocational candidates seeking to enter general practice training, so they are based on clinical knowledge that candidates should already have a handle on. To prepare for the CACT, you can use the RACGP General Practice Education Framework available on the RACGP website. This framework refers to the competency profile of the Australian General Practitioner at the point of fellowship, which details the 5 domains of general practice and the core skills that sit within them. These can guide you in the type of knowledge you may be tested on, and sample questions are also available on the RACGP website. We do encourage you to take a look at these and familiarise yourself with the style and format of the different questions that may be asked. From the 9th of July 2020, candidates can log into the AGPT portal to view their ranking band from the CACT. This gives an indication of how you performed in the test. Ranking bands range from 1 to 10, with 1 being the highest performing band. Applicants need to reach a minimum standard in the CACT to proceed to the next stage of selection. Following the release of the CACT results, there is a short preference change period during which candidates have the option of reviewing and changing their training preferences before interview allocations take place. During this time, candidates will have access to a preference distribution matrix, which allows them to see how many candidates from each ranking band have preferenced each training region and each pathway, compared with the number of training places available. This gives an indication of how likely it is that you will be allocated to interview with one of your preferences, and you may decide to update your preferences once you have that information. The third stage of the selection process is interviews and offers. We don't know yet whether by the time the interview period arrives, it will be advisable to be shaking people's hands like this, in this lovely photo here, or if it will be advisable to be meeting in person. So it may be that the selection interviews will be conducted by video call for this intake. Candidates attend up to 1 interview only per round. In other words, you are unable to interview for multiple regions within 1 round. You can only interview for the region you have been allocated to. Applicants are allocated an interview according to their capped ranking band and the number of training places available in each region and on each pathway. The preference change period is an opportunity to assess your situation once the capped results have been released and consider how to maximise your chances of being allocated an interview. It's still important only to nominate training regions you are willing to train in for the duration of the program. Interview allocations will be released to applicants on Thursday, the 16th of July, 2020. It is important to note also there is no guarantee that all applicants who achieve the minimum standard in the CACT will be allocated an interview. There are a limited number of training places available, and so interview places are limited too. If you are allocated an interview with one of your preferences, you are unable to then change your interview allocation. This is why it's important not to nominate training regions that you are not willing to train in. Your only option at this time is to proceed to interview or decline the interview. Interviews will run from Saturday the 25th of July to Sunday the 9th of August. This period was recently extended by 1 week to account for the possibility of having to conduct interviews by video call, but we will keep everyone updated who is made an offer. Interviews are scheduled, facilitated and conducted by the RTOs, in this case EV and MCCC. Specific information about how and when each RTO is holding their interviews will be made available on their websites, and you're encouraged to keep an eye out on these. Interviews are conducted in one of two possible formats: the multiple mini interview format, where the applicant moves from interview station to interview station, or single interview format, where the whole interview is conducted by a single panel. The format will be chosen by the RTO and of course will depend upon whether interviews are occurring in person or not at that time. In the past, MCCC have run the MMI interviews or the multiple mini interviews, and EV has run single format interviews. Both RTOs are working on how best to run the selection interviews, so we would encourage applicants to keep an eye out on their websites for more information and sign up to their respective newsletters to stay in touch. Interviews consist of at least 5 and up to 8 questions. The first 5 questions are standard. All candidates respond to these same questions. Then each RTO has the opportunity to ask up to 3 further questions, which may be related to their region. Following interviews, successful applicants will receive a letter of offer via email from the RTO they interview with and are required to respond promptly. All offers and acceptances will need to be finalised by Friday the 21st of August 2020. This date was also recently extended by 1 week to allow for a longer interview period. We've already covered most of the changes made to the selection process so far. So in response to the situation involving COVID-19, however, I would like to reiterate these again now. There is also an important update on the general registration requirement that you guys should be aware of. We are also exploring different ways of delivering the CAC that meet social distancing requirements and the possibility of selection interviews occurring by video call. We will keep you informed, so please read any emails that come through from the RACGP carefully and keep an eye out on our website. The important change regarding general medical registration that I'd like to draw your attention to is that there will be 2 commencement periods available to the 2021 AGPT program cohort. These are January, February, or July, August. To be eligible for the AGPT program, applicants must hold or expect to hold general medical registration by commencement of either these training terms. Applicants who currently hold provisional or limited registration are able to apply. However, training offers made to these applicants will be conditional upon them receiving general registration before the commencement of training. If general registration is not received, the training place offer may be withdrawn. As the situation overall remains fairly fluid, we don't quite know how long we will need to employ social distancing and isolation measures in our everyday lives. There may be further changes made to the selection process down the track. Whatever the case, the RACGP will ensure that you're made aware of these changes and how they affect you, and the latest information is always available on our website. One of our main priorities is making the selection process as smooth as possible for you and to support you on your path to vocational training and doing the most important work that general practitioners do. Irrespective of whether you have sufficient hospital experience to go directly into general practice or whether you need to stay in hospital, you will need all of this information so you can be assessed to see if you can go directly into practice. Some of these documents take time to source, so we encourage you to begin collating this information earlier so that they are available as close to the time that you accept a training position as possible and the commencement of your training is not delayed. Please do contact your relevant or preferred RTOs in your preferred training regions if you do have any questions about the requirements or how to obtain these. At the top of the screen here, we have a few directions for accessing FAQs relevant to AGPT selection, as well as the relevant RACGP policies and guidance documents. In particular, we're often asked a lot of questions about things like hospital rotations, recognition of prior learning, and paediatric term requirements. Regardless of how much information you provide about your personal circumstances, we cannot tell you how much RPL you might get. We're also unable to tell you if your paediatrics experience or hospital rotations are sufficient. These are all issues that you will need to discuss with your RTO after you are accepted into the program. The best advice we can offer on these topics is to consult the various policies and guidance documents available on the website. These provide information on what may or may not be considered, so please read them carefully before speaking with your RTO. We also receive a number of questions regarding leave, deferment, and the possibility of transferring between training regions while training. These areas are governed by the Department of Health and their AGPT policies. We do encourage you to read through the relevant policies which are available on the Department of Health's AGPT website. We now have, there are a number of resources available to AGPT applicants and potential applicants if you are considering GP training. There is a wealth of information on the RACGP and Department of Health AGPT websites, including the FAQs, policies, and guidance documents mentioned. There are also guides that have been developed to help you understand the different training options available to you and the requirements of the AGPT program and selection process. Please make sure that you take a look at these guides and also monitor the RACGP and AGPT websites as they are updated throughout the selection process. The Department of Health's general website is also a valuable resource as mentioned, particularly the Health Workforce Locator, which allows you to see which areas around Australia are classified as metro and which are classified as rural. This can be useful in deciding between the general and the rural training pathways. Applicants can also refer to the GPRA website for information and support, including the national terms and conditions for the employment of registrars, which, as mentioned, outlines the minimum amounts GP registrars need to be paid. This website also provides other useful information about your rights in terms of working conditions. And finally, the RTO websites are an invaluable source of regional information, and you can find links to these on the RACGP website by following the directions shown on the slide. We now have Dr. Damien Hannon, who is an EV registrar currently training in his third general practice term. So I might hand over to you, Damien.
Hello, hi everyone. My name is Damien Hannon. I'm GPT3, which means that we do 3 different terms within GP training. The function of that is the way that outlined is basically 3 6-month terms, specifically in general practice, and then you can consider changing after that for the final 6 months of training into doing either an extended skill or an area of specialist interest. I'm working a blended contract at the moment, so I work 3 days a week as a registrar and then 2 days a week as a medical educator, and that's sort of how I mix up my week and keep it interesting for myself. If you're already thinking about general practice, then you're well ahead of the curve. You've clearly are interested, and I want to really talk to you today about why general practice is so enjoyable and what you can expect as a registrar. Like a lot of you here may be applying, you may have had various previous medical lives. I've locumed, I've worked in multiple emergency departments and various hospitals across multiple countries, and I suppose that experience has been invaluable in general practice. The good thing is that any experience is good experience when it comes to general practice, and but I would also remind anyone who's working as a intern or resident that you won't be penalised by the fact that you've chosen to go into general practice earlier and maybe don't have as much experience as some others. One of the great reasons about why I enjoy it is that there's a real variety to the working day. So within the same morning, I can see someone who's 6 months old and then someone who's 96 years old, and what I have to do is be able to manage the variety of presentations that all of those people can have. The other really great thing about it is that there's continuity of care, which means that you get to actually find out what happens to patients. You get to know whether the interventions that you make have any meaningful or lasting impact. And finally, it's really just sort of complete for me. I find it quite satisfying in the sense that, when I worked in emergency departments, I found myself always following people for days and throughout the hospital to see where their admission led to. And now I get to sort of control that. I have a bit more control over that, and looking after them through the entirety of their illnesses or their chronic conditions. And that, like I've talked about, sort of comes from that cliched phrase, cradle to grave, but it is really true. And it's something that I really enjoy about my job, is that variety. There is an ability to subspecialize, as we've discussed earlier, and you can really do that in any area that you have a particular interest. So if you're interested in sexual health or obs and gynae or skin cancer, or like me, medical education, you can basically use general practice as a sort of platform to build any career that you would like. The number one reason that I really enjoy general practice, however, is that I have my own autonomy, and I find towards the end of my hospital career that I sometimes thought decisions that I didn't agree with were being made by other clinicians, and as a sort of junior person on that team, I had to go along with that. And now it's really nice to be in a position where you can sort of talk to people and give them the full array of options rather than sort of deciding for them, and be involved in a lot of joint decision making. And I think that, that's really something that is sort of unique to general practice, is that you really do just sort of do it on your own. You're not running everything by someone else all the time. And obviously the final reason is that there are no hospitals involved, which can be both a blessing and a curse. So far in GP training, I found that to be the most enjoyable and rewarding work that I have ever participated in professionally. The things like, if you've had a busy morning and you don't make it to morning tea, someone brings you a cup of tea. The small things like that make general practice worthwhile, which is such a nice place to come to work every day. And clinics often harbour, a certain culture, and they're quite protective of that. And therefore, whenever you get the privilege to work in a certain clinic, they really are interested in making an investment in you. As someone working in a rural area at the moment, I can attest to the fact that actually by coming out and doing some time rurally, people are that extra bit grateful for their care and their treatment, and particularly at a time like this when we're all sort of dealing with a pandemic. General practice training is very flexible, so you can do your training part-time throughout if that needs to happen, and for a variety of reasons, including either your ongoing professional development or for family planning reasons. Any reason that you need to be sort of working part-time, that can be negotiated with your RTO from early on. I talk about the little wins and the big wins in general practice. Little wins include things like, seeing someone's HbA1c finally get under 7 for the first time as they've lost a bit of weight. But there are some big wins whenever you see, a patient sort of recover from a significant illness, or you see their mental health particularly improve over a period of watching them, and caring for them over 3 to 6 months, and you really get that feedback that actually what the work that you're doing is worthwhile and appreciated. For me, a highlight of general practice training, once I'd selected my RTO, which is AGPT, that I knew exactly where I was going to be living and working for the coming 2 years. There is concern sometimes when you apply to different RTOs about where you might end up being placed. Within ABGP, you can only be placed in clinics that you apply to. So if you're a bit apprehensive about being 3 or 4 hours, if you don't want to work in Malakuta, for example, you'll not be forced to do that. You have to interview there, and basically you'll go into a system where you're matched based on your preferences. So don't be hesitant about applying it, particularly to rural spaces, just because you feel like you get sent out too far. And the final bit is that the patients, if you haven't already worked out, are the reason why all of us do general practice. It's they're the reason we come to work every day. They make me feel, I feel like I make a difference to their lives, and I know that they definitely make a difference to mine. And it is really rewarding to see those, to see things go well for people. Likewise, the most challenging bits can also be the patients. And sometimes it can be frustrating that they don't necessarily do the things that you would like them to, or just ignore your advice completely. And that's okay. You can't win every battle, but I think at the start I found that a challenge. In hospital, people take their insulin when they should, and they eat appropriately, and all of a sudden things look better, and then they go back out into the community and the wheels can tend to fall off from time to time, and that as a doctor can be quite frustrating, because I think we all have this innate desire to fix people and look after people, and sometimes you have to let go of your I realize that it's more of a shared decision-making process. Managing patient expectations has been a big challenge in general practice as a registrar. Quite often people have an agenda, and there might be 6, 7, 8 things on that agenda. You'll have maybe 20 minutes to deal with that. So I think as you start, you need to get into a pattern where you can really learn how to deal with what's the priority at the beginning, and sort of set out your agenda and their agenda, and agree on a few focused issues, and then manage your time appropriately, so that you're not staying, until 10 o'clock at night doing work. And that is a reality of general practice, is if you don't become efficient at time management, there's no one else that you can necessarily hand over to. No one else is going to look after your patients for you. So it's just, and that's something that you're very much eased into as a registrar. But the other challenging bit is that for the first time in your career, you might find yourself in a position where you don't know the answer to something. And it might be that, someone looks a little bit unwell, but you don't have a chest x-ray, you don't have means to do that, you don't have access to bloods, and you're left in a position where you basically have to go with your clinical skills and your sort of gut feeling. And that can be a bit challenging if you haven't done any work like that before. But the good thing about doing anything like that is that you're, as a registrar, you're still very supported. And for the first 6 months in particular, your supervisor is either on site with you all of the time, or available to contact by phone at least 80% of the time after the first 3 months. So you can look forward to that sort of environment to learn in. And I found my transition into general practice probably the easiest transition into any job that I've ever worked in medically. I had a full day of just being shown how to use computer systems. I had passwords on day one, and we operated in a way that my supervisor had gaps in her schedule, so that I could always come into her room and ask questions if I had any. As the time goes on and you're feeling a little more confident, that can transition into something called wave consulting, where you basically see a patient on your own, and at the end your supervisor might just pop in, either agree with your plan or sort of help you out with any issues that you might have encountered during that patient interaction, and then you can formulate a plan together. And patients actually quite like that as well. I at the start was worried that it looked like I was maybe a bit incompetent, but that people feel a bit special sometimes when there's two doctors looking at them. So take advantage of that and make sure you use a supervisor, because these practices are being paid to look to train you, and you should be getting dedicated education. And as a GPT1, you'll be doing 3 hours a week, which is dedicated face-to-face teaching. And what I also really liked was that as a registrar, we were able to get together every 3 weeks and do face-to-face peer workshops, which were led by our medical education team, which I'm now a part of as well. At the moment, we're having to transition just doing that sort of through webinars in different formats, obviously in the setting of the pandemic, but the hope would be that next year that would return back to normal. Other potential aspects of general practice life, if you have any interest, aged care is a big part of general practice work in most clinics, because they usually have people who fall into that age bracket, but also I think we have a duty of care to follow the people through who move into an aged care setting. I don't think it's fair that they just have to get a new GP because they've got older. So if that's something you're interested in doing, you can make that a sort of backbone of your work, or a key part of your 1 or 2 days a week. A lot of people do anesthetics, particularly in the rural setting, but if you're interested, you can do pediatrics, emergency medicine, GP obstetrics, medical education, sexual health, and skin cancer medicine. And I thought I would just finish my few minutes talking about one complex case in particular. I have a lot that I've encountered over the last year, but this one was the highlight of my year, and it made me feel really professional. It made me feel very professionally motivated to continue with my studies, and realize that I was in the right place and what I got out of this encounter was really meaningful. But I had a 78-year-old guy who came to see me, who's recently moved into supported living. He had a rapid cognitive decline, which I investigated appropriately, and he had a dementia screen which was normal, scans which were normal. Basically, he was found collapsed 6 weeks later, and was actually found to have quite a large left frontal lobe tumour, which he had debulked at a hospital neurosurgical unit. But as a result of that, he came back and he was increasingly dysphasic and with a worsening swallow as well. And so he asked to see me to discuss voluntary assisted dying, which had just been passed in Victoria around that time. And I had the privilege of being involved in that as a registrar, which I hadn't anticipated doing. And
Gary.
I was able to be with him and his family, and sort of be involved in the assisted death at home. And this is a guy that got a lot of dignity back in a setting that could have been really undignified for him to die in. And so for me, that was my personal highlight last year. But this array of complex cases are everywhere in general practice, and that's just one of the things that I've seen. I wish my job was all coughs and colds. Sometimes at the minute I feel like it slightly is, but generally it's not. You have a wide variety of things that you see, and I find general practice to be a real privilege. The information, and I've got a lot out of it, as well as what I think the patients have got out of our encounters. And just I was killed with kindness at Christmas. People kept buying presents for my dogs, so there are small perks to it. But I think if you're really interested, general practice has an opportunity to change your life and really change your perspective on how you see the people in the world. It'll maybe offer you a chance to balance your life again after the craziness of working in hospitals for a while. And finally, I would just like to say that if you're feeling brave enough, please consider a change of scenery and come out and see us in Eastern Victoria. We'd be very happy to have you.
Awesome. Thank you so much, Damien.
My pleasure.
Just before I go through these key contacts, I would encourage anyone who has a question to use the question pane in their GoToWebinar control panel. We will have about 11 minutes for questions. So please take the time to type your question down. In terms of key contacts though, there are two main bodies that you will deal with during the selection process. During stages 1 and 2 of application and eligibility and the national assessment, you will deal primarily with the RACGP. Up there on the screen is our contact email and telephone number. If during the process of completing your application or progressing through any of the other stages of selection, you do have any questions or queries that cannot be answered using our online resources, we do encourage you to get in touch and we will do our best to assist you or point you in the right direction. During stage 3 of the selection process, interviews and offers, your main contacts will be the RTOs, as discussed, the RTOs are also your best point of contact for questions about recognition of prior learning, hospital rotations, as well as specific information about what it's like to train in those regions. Okay, we have heaps of questions coming in now. So just bear with me while I gather them all. Lynn Marie, I might throw to you for this question. As an intern, do I need to have a PEDS rotation to be eligible to apply to the AGPT program? Lynn Marie,
Thank
are you there?
Yeah, you had me on mute.
Sorry.
That's all right. No, you don't have to have had PEDS to apply, but you need to have your PEDS rotations completed to become practice ready to enter into general practice.
Awesome, thank you. And also, Lynn Marie, I'll get you to answer this one as well. Is the interview process with the RTO separate to the interview process with the individual practices?
Yes, that's correct. So you have your interview with the RTO, and then once you've been given an offer, you will go into the registrar placement process if you are practice ready to do so. And the interview process is individual with the practices that you apply to.
Awesome. And if somebody's RPL is not accepted, how would they be able to meet the minimum requirements?
I just want to make it clear right here that practice readiness is different to RPL. So your practice readiness is assessed from rotations that you have done prior to and after your first full general registration. So if you are deemed practice ready based on those rotations and you go straight into general practice, you then would complete an were to make up that 12 months of hospital time, but that is taken from hospital rotations after your first general registration. Does that make sense? They're two very separate processes.
Yep, awesome. Thank you. How many training positions are available in the Ballarat region? Could you please repeat where this information can be found?
Say that again, sorry.
How many training positions are available in the Ballarat region? Could you please repeat where this information can be found?
Well, off the top of my head, I can't give you a specific answer to that. If you go onto the MCCC website, there is a tab at the top as where you can train, you can go on to there to the northwest section, and all of the practices are listed in there, and you'll be able to see how many practices are there. But it's very much a changing situation. We don't really get the final numbers until just before the placement process. So between the time that those offers are finalised and the start of the registrar placement process, we're in touch with the practices to ascertain exactly how many vacancies they have in the area. So I can't really give you a finite figure at this point.
And is there opportunities to pursue a special interest in medical administration within GP training?
Yes, there definitely is. There are advanced skills training posts where registrars can pursue that side of it, and if they go into rural generalist training, they can do consolidation of skills later, but definitely there are opportunities there.
Is someone able to do extra years in hospital after being accepted into GP training? For example, after their first hospital year within the GP program, to gain more experience in other years, can you do an additional few years?
A rural generalist registrar can do an additional year, but generally registrars are limited to 1 year in hospital.
And is there an age limit to apply for the program?
No.
Amazing. Someone here has said that they are having a little bit of difficulty getting in contact with MCCC's email. That email
Well,
on the screen, info@mccc.com.au, is correct?
that's correct.
Awesome. And what study materials, resources can I use to prepare for the CAT? As I pointed out, there are a few materials available on the website to study for the knowledge test questions. The situational judgment test questions you cannot study for because they are more looking at your professional conduct and reasoning.
And I would suggest that it's really the knowledge test is based on stuff that you probably already know and are managing in whatever role in hospital that you're in. It's not beyond a level that you would be expected to have of knowledge that you would be expected to have already, and therefore I wouldn't recommend doing. Obviously, look over the RACGP resources for that, but beyond that, I wouldn't recommend doing additional work and don't pay money to do any online courses that are advertised for it. It's not required.
Also, Damien, I might just ask, what is some advice that you would give to some of these potential applicants going into the interviews with the RTOs?
Again, don't be particularly stressed about knowledge as such. The scenarios are quite open and broad based, so it's really to see that you think appropriately and are going to be a right fit for general practice, rather than you're not expected to know how to manage certain conditions. It's all about getting a feel for what your area of interest are, and then there's appropriate clinical scenarios, how you would manage them, and there's no right or wrong answer for it. But I think the point is that if you demonstrate that you can justify your management and your clinical reasoning, that's the kind of qualities that they're looking for.
Awesome. Lynn Marie, I might throw to you for this one. How do we go about exemption for 19AB?
19AB exemption is something that you need to organise with the Department of Health and Human Services. It's not something that the RTOs deal with.
Awesome. And can overseas trained doctors apply for the general pathway to work in inner outer metro areas?
Overseas trained doctors are limited to the rural pathway. and the best thing to do to check what areas those are in. I know with the MCCC website, we've got all our practices listed there, and it tells whether or not it is a general or a rural pathway, and I imagine EVGPT would be the same.
Yeah, if you look at the map that was on screen earlier of the regions, the darker green area closest to the city, that's considered our metro training cohort, and then the outer area that's lighter green is the rural area, and therefore if you're applying to rural, you can only apply to that, and you're a 19AB, you can only apply to that outer area. And I should stress that you can't move. You can't move from rural to general during the program. You know, if you're committing to a particular region within the RTO, at least with EV, you're committing then for that 2-year period.
The same with MCCC.
Awesome, thank you guys. That's all we have time for question-wise tonight. If you did not get your question answered, we have taken note of these and we will get in touch with you regarding your questions. And okay, that was question time. And that's all. Thank you everyone so much for taking the time to come tonight. I'd also like to thank Dr. Damien Hannon and Lynn Marie Richards from EV and MCCC respectively. Appreciate your time answering these questions and being involved tonight. If anyone else has any other questions, please do feel free to get in contact with MCCC or EV or the RACGP, and we'll be happy to direct you to the correct RTO. Thank you, everyone.
Thank you. Bye-bye.
Thank you.